Let's talk about aseptic meningitis and the whys behind the lab values. So your white blood cells, you can see they're elevated, and so viral infections trigger the immune system, leading to lymphocyte recruitment of the CSF to fight the virus. Unlike bacteria, viruses are intracellular, and so T cells, especially CD8 positive T cells, dominate the response. Lymphocyte, so you're going to be lymphocytic predominant. It's because viruses live inside the cells, and so your body deploys lymphocytes, not neutrophils, lymphocytes to handle the intracellular pathogens. Your glucose is going to be normal because viruses don't consume glucose the way the bacteria does. There's no massive neutrophil load to soak up the glucose, and so the levels are the same for glucose. It's really important to look out for. For viral, the protein is mildly elevated. Inflammation increases the permeability of the blood-brain barrier and allows some protein leakage to occur in the CSF, but it's not as drastic as it would be if you got like a whole bacteria inside of you. Opening pressure is often normal or slightly elevated. Mild inflammation can raise the intracranial pressure, but less dramatically than bacteria. So then you think about bacteria, white blood cells, massive neutrophilic response leading to extracellular bacteria. So yeah, white blood cells are going to be much, much, much higher if this were a bacterial infection. Glucose would be low because bacteria eats the glucose, and so neutrophils consume even more, and so your glucose would be super duper 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 low. Protein, severe inflammation leads to the leakage of the plasma proteins and breakdown products, right? So you're going to have very high protein because the leakage of those proteins are going to be seen because the bacteria are chomping away. The pressure is elevated because there's going to be a purulent inflammation that causes intracranial pressure. So viral means you have milder inflammation, lymphocyte-driven, no heavy metabolic demands on the bacteria. And so in this particular question, we've got a 5-year-old boy, headache, neck stiffness. We got 120 white blood cell, protein is 65, fully vaccinated. What do we got? It's Coxsackie. It's going to be a lymphocyte, normal glucose, vaccinated child, viral aseptic meningitis enterococcus. So a fever, meningeal signs, headache, neck stiffness, and cerebrospinal fluid that shows lymphocytic pleocytosis is going to have your moderately elevated protein level, and normal glucose would tell you it's aseptic meningitis. And enterovirus is just the most common form. All right, so that's pretty much all there is to know about this particular question. Yeah, we'll see you in the next video.